I was on a baby aspirin and a drug called pentoxifylline.
Pentoxifylline, yeah.
Pentoxifylline. Okay.
Yeah.
About 4 weeks ago, I came down with anemia. Second, I had anemia last September, and it came back on me 4 weeks ago, and my doctor told me to stop taking the baby aspirin until I get blood work that would show my hemoglobin count and red blood cell count would be, back to normal.
Right.
Is there anything else I could take in place of the aspirin, or do I just live without it for a couple months, 2 or 3 months?
Yeah, it's a tough call. We always say like the only reason why we want to stop any of those things if you have a bleeding problem, that's pretty, or a severe allergy. That's about the only 2 times we ever say to hold or stop a medication. Unfortunately, if you have to stop aspirin, all the others also will potentially cause bleeding. Sometimes the theory is that aspirin, even if it's a baby dose, may cause more bleeding than a Plavix or a Xarelto. So sometimes in some patients, when I have them on both medications, I'll have them stop the aspirin first, keep them on the Plavix or the Xarelto, and then if they still have problems, I have to stop both until we get a solution, if we can.
Okay.
So you're on pentoxifylline, which is a medication called Plital. That's the goal of that one, if they've explained it to you, is to try to help your blood vessels kind of juice up on their own.
Yeah. They said it would make the cells more flexible.
Yeah, so it's not a blood thinner, even though some people stop it for procedures. So it's not typically one that should cause bleeding. That's why they probably didn't tell you to stop that one.
Yeah.
But the aspirin, if you stop it, if you were on both, I would stop the aspirin, keep you on the Plavix. So if they can't find a solution, you can always ask, is it okay if I at least get on Plavix or something else to protect you?
Okay. It does lead me to another question. 2 weeks ago, I got diagnosed with acute urticaria. So I had a full body allergic response. Is it possible that some of these drugs that I'm taking, like I've been taking this pentoxifylline for 3 or 4 months, and other medications, some I've taken for years. Is it possible that all of a sudden I've developed an allergy to one of these drugs? And
yeah, unfortunately, you can get delayed allergies to medications. It's always possible. The best people for that, what they do is your doctors typically stop one by one, and then restart one by one. And sometimes they send you to an allergy specialist where they can test certain things. They can test for other environmental, clothing, food allergies. Unfortunately, when you're taking, like, let's say 20 pills, it's a little hard to tell which one, but usually we'll say stop the most recent one. And see if that makes a difference.
Okay. I won't stop anything until I talk to my doctor.
Yes, please.
The lessons are already
Please talk to your doctor first. Yeah.
Thank you.